Let's break down the new 2025 SVIN Clinical Practice Guidelines for EVT in large core stroke. The big question: does endovascular therapy actually benefit acute stroke patients presenting with large infarct cores? These guidelines synthesize consensus data from 6 pivotal randomized controlled trials on large core EVT. Eligibility windows across these trials were strictly defined by time of onset paired with aspect scores. The clinical trade-off: EVT improves 90-day functional outcomes, but symptomatic intracranial hemorrhage risk definitely increases. Reassuringly, pooled meta-analyses show a relative risk of 0.95, so 90-day mortality remains statistically similar. Translating this data to practice relies on the standard SVIN level of evidence and recommendation framework. Let's look at the early 0 to 6 hour presentation window. Here, EVT earns a definitive Class 1 Level A recommendation for patients with aspects 0 to 5. Next, the extended 6 to 24 hour presentation window. In this late window, Class 1 recommendations only apply for a tighter aspects of 3 to 5. However, for aspects 0 to 2 in this extended window, the EVT benefit remains uncertain. Class 2B. Finally, let's cover patient selection and special clinical caveats. Guidelines explicitly exclude patients with profound ischemic changes like midline shift or active clinical herniation. So how will you implement these evidence-based SVVAN parameters into your stroke center's everyday EVT practice?